thank you everybody for being here. Bonjour tout le monde. My name, as you heard, is Jacqueline Gahagan. So again, it's my pleasure to be here facilitating this discussion today on policy issues related to housing and aging population. As you know, this flagship event is part of the work that the McEachern Institute does, and I'm very proud and pleased to be part of that work. And I think we've got a wonderful, robust conversation happening already in the green room. We're all kind of talking about the work that we're doing, and I think that speaks to the excitement that we bring to this issue, the passion and the excitement. Before we get started with introducing the panelists, I'd like to just offer a few comments as opening remarks about why housing policy is such an important health issue for us to consider. And I talk about it as a health equity issue because from my perspective in the work that I do, housing is a key determinant of health. So if you want populations to stay well, you need to think about things like housing. It is a key determinant of health. One of the things that I wanted to just mention as a specific example is thinking about older populations that are often absent from our policy dialogues regarding why this is an important health equity issue. So I want to just draw your attention to the fact that the same generation of older lesbian, gay, bisexual, and trans folks who experience stigma, discrimination, violence when they were forced into the closet by social marginalization in their younger years, now in their older years are facing the likelihood of the final closet. Something to think about. Sorry, I'm getting over a head cold, so can everybody hear my booming enough? Yes? Okay, good. So think about that. Think about what it looks like for older LGBTQ folks in Canada to find safe, affordable, culturally competent housing in the mix. Something to consider. So what often happens is older LGBTQ folks will end up hiding or denying their sexual orientation and or their gender identity to remain safe in uncertain housing situations. This is an important policy issue in relation to housing in that we know globally the health outcomes of lesbian, gay, bisexual, and trans populations are, on average, much worse than their heterosexual age-matched peers. This trend is the case for LGBTQ populations here in Canada, and this trend is particularly profound in regions of the country where there's limited supports for LGBTQ populations across the life course, including housing supports. As you likely know, the Atlantic region, where we are currently housed, on average has higher rates of chronic disease, including a higher burden of cancer, disability. Hello.
Hi, sorry.
No problem. Join us, please. Higher degree of or rates of poverty and unemployment. So these complex and intertwined health and social factors actually contribute to poor health outcomes across the life course. The relationship, however, between health systems, health policies, and the burden of health on LGBTQ populations as they age in the Atlantic region is less well understood. And although we're witnessing great strides in advancing LGBTQ rights in Canada, it's important to note that, for example, in Nova Scotia, Prince Edward Island, New Brunswick, Newfoundland, and Labrador, we've adopted human rights legislation at differing rates. So why does that matter? The staggered approach, may stymie the process for policy recalibration in terms of our health and social policies. This has implications for housing. So, for example, when we think about the fact that homosexuality was decriminalized in 1969, why was it then that we didn't see same-sex marriage becoming legal until 2005? And what's interesting is nationally that became legal in 2005, and yet it wasn't until 2008 that we saw same-sex marriage was legal in PEI in 2014 in Newfoundland and Labrador. Further, the rights that one might have challenged in seeking housing can be complicated by things such as who has the right to make decision-making responses for individuals who are seeking housing. So this is complicated because we know that there are healthcare systems that require time to recalibrate their systems and how they approach policies, such as intake forms, electronic health records, etc. Policies also need to change to keep in step with important health equity issues. In the required readings that you did for today, I just wanted to mention briefly one of the papers, which is a paper that I penned, which is called Improving Pathways to Primary Health Among LGBTQ Populations and Healthcare Providers. And I want to use this as an example to illustrate the potential disconnect between what older LGBTQ folks say they need and what healthcare providers assume they need. So that disconnect has important implications for the development of policies, I would argue. In my work with the European Union Centre of Excellence here at Dalhousie, we're actually looking at research, and Ren is involved in this research, looking at how to realign housing policies to be more amenable to the unique needs of older LGBTQ populations. And I think that's a significant challenge for us to think about. So what I hope that you will consider throughout this discussion today is the diversity of the Canadian population and the complexity therein of developing health and social policies that are meaningful and applicable to the needs of those populations. So you're going to hear from our panelists a little bit more about their take on these various issues, but please do keep in mind that the one-size-fits-all approach to policy tends not to be effective. So just to run you through the process from here on out, each panelist will have approximately 12 minutes to present their key messages. So it is my pleasure to introduce the first panelist, Elizabeth Haggart. Elizabeth works for the Department of Seniors here in Nova Scotia. She's the policy lead for SHIFT, which is Nova Scotia's action plan for an aging population, a comprehensive and horizontal government strategy that was launched in 2017. Elizabeth taught for 11 years at Mount St. Vincent University in the Masters of Adult Education, Studies and Lifelong Learning program, while working full-time in policy roles with the Nova Scotia government. Over the course of her career, she has worked in a variety of capacities in the public, private, and education sectors in Nova Scotia, Ontario, Mexico, and Jamaica. Elizabeth holds a master's degree in adult education. Please join me in welcoming Elizabeth.
So I have a question for you. Put up your hand in this room, all of you, and those of you who are watching at home, put up your hand if you're aging. Good answer. It's good to see. So as you know, we're all aging. We're all in this together. However, when we speak about an aging population in this context, what we're talking about, of course, is the notion that as a population, as a whole, our average age is increasing. And so we're seeing a lot more older people in our population. And one of the neat things about when we're about our aging is that as we age, more and more of and we add more and more days and months and years to our lives, we're amassing an extraordinary amount of experience and knowledge and skills that we can bring to bear on the age around us. So when you think about the fact that we have a much older population or a population that's getting older, think about all the experience and knowledge that we could tap into and the advantages that we could bring if we can tap into our older population. So I'm just going to throw out a couple of stats. Right now, 1 in 3 Nova Scotians is 55 and over. About 20% of us are 65 and over. And the 80-plus group is the fastest growing group in our population. There are more and more people turning 80, and that's because we're in healthy lives. Just keep that in mind. But I don't really want to get hung up too much on chronological age, because our experience of aging is a highly individual experience. Each one of us, as we age and when we get older, are shaped by our experiences individually throughout our lifetime, our socioeconomic situation, our membership in certain communities, our identities and how those intersect, where we live, etc. And these things, of course, also play a role in our health. And as Jacqueline has already pointed out, in referencing the LGBT community, various different populations have very specific needs and interests and challenges. And so we need to be considering that diversity of our older populations. As diverse as the broader population. We can't lump older adults into a group. The other thing is that age, our health is not really linked to chronological age. We tend to think that aging is that an inevitable period of decline, and it doesn't have to be. And for some people, age is compounded by other factors, but we need to lose the stereotype. We need to understand that our population is very diverse, and we need to respond. One size, as Jacqueline already said, doesn't fit all. However, there is one challenge that seems to be broadly experienced by many older people, not everyone, but many older people, and that's the broad challenge of social isolation. And social isolation is the emerging absence of meaningful relationships in our lives. And it's not only linked to, and it's not only a link to loneliness, but this particular concept of social isolation can have a profound impact on our health as we age and our ability to contribute and be continuing part of our population. And there are many reasons for that. It may be our identity, it may be our health, it may be the fact that all our friends, or we've lost a spouse, we've lost friends or a spouse. So we need to be aware of that. And so anyway, but it's also linked to these significant increases in health. And just as an example, social isolation has been linked to a 60% increase in the onset of dementia in a longitudinal study, a large longitudinal study that was happened in the States. It's also linked to other factors. And it's not just about the fact that our ill health causes us to be socially isolated. There are other factors at play. This is actually our health issues can be an outcome of social isolation. So, as we consider the concept of housing and planning for housing, one of the things we really need to think about is how do we keep our population connected and involved and participating in community. There's an enormous advantage in having our older population connected. We want to be able to tap into their contributions and and have them participate. We know that there's a connection to health. And so we really have to consider that. But here's another thing we want to think about. We in a society seem to have evolved into separating our generations from each other. We've actually isolated the generations from each other. So, for example, we may have a group of frail older people in a nursing home that's way out in the boondocks, isolated from communities and networks. My dad lives in a nursing home, and it's an industrial park. We can't walk outside into a neighborhood and see children or older people. So that's one group of it. We put children in schools. We put middle-aged people or working-age people are going to work in different locations. So we tend to be cut off from each other. And this has an effect on the concept of intergenerational solidarity, which is considered to be a really important notion for a healthy society. When you have the generations mutually supportive, understanding, and engaging with each other, that actually is really good for society as a whole. And again, that speaks back to the issue of isolating our older people. So my message today is not about housing, more specifically is that we need to consider, in the context of our housing planning, we need to consider things like how do we, in the concept, when we're designing our housing and our planning, what are we doing to keep the occupants of those homes and those places engaged with the broader community, engaged with other generations, involved and participating in all aspects of life in our community. And that's when we will have a healthy, aging, supportive population. Now, I want to just draw your attention to one thing. I'm not going to get into the details of SHIFT, but last year, the Premier of Nova Scotia announced a government-wide strategy and action plan to address our aging population. This is a response to the aging of our populations. It's called SHIFT. It's about leading a shift in thinking about our demographic shift. It has 3 specific pillars. One of them relates to valuing the contribution of older people to our communities and to our province. The second one is about helping people to age in place. Stay supported in their communities and connected to their communities. The connection to community is extremely important. And so in that particular section, we address things like transportation, housing, social connection, etc. The third one is active, healthy living. And that not only addresses notions like, or things like the fact that we need to stay healthy and active and physically active and have access to good food and that sort of thing. It also reflects the importance and the problem of poverty and how that affects aging. So these are all addressed in SHIFT. I'm not going to get into the details of it, but I would encourage you to have a look at it. It is available online. The URL is novascotia.ca/shift. And I'll look forward to your questions afterwards. Thank you.
It's now my pleasure to introduce my colleague and founding fellow, Dr. Ren Thomas. Dr. Thomas, well, we've heard from your opening comments that Ren is an assistant professor here at Dalhousie University in the School of Planning. She's a researcher, writer, and instructor who is highly passionate about housing, transportation, growth management, and governance in urban centers. I would like to welcome Ren to the podium. Thank you.
I would like to talk a little bit about, my introductions said that I have worked in the area of housing a lot. I've also done a lot of research around transportation, and some of my work has really looked at I guess what I would call specific population groups, so youth and young adults, immigrants, women, and I think there are a lot of similarities in the housing needs for these groups and the housing needs for seniors, so that's kind of the theme of what I want to talk about today. So most of these specific population groups that I mentioned have smaller household sizes, they have lower than median incomes, many of them do not work full-time, for example, young people, students, they often can't afford home ownership. And they often need to live in areas, and Elizabeth touched on this already, areas that have good access to transit, to services, that they can walk or take transit to these kinds of different things that they need, because they tend to have low car ownership as well. So seniors may need slightly different housing options than some of these groups. For example, they may need a little bit more on the supportive housing side. But for the most part, what we're talking about is the same kinds of housing needs across these groups. So we're talking about affordable housing. We're talking about probably not ownership housing, so different tenures, either rental or cooperative, maybe co-housing. And we're talking about housing that is, that has supports nearby, or within the same building. So we're talking about being able to walk to things, being able to take transit. So this has been kind of interesting in looking at the kind of housing research that's out there. That a lot of people are really advocating for more with housing choices, basically, a little bit more diversity than what we've been seeing traditionally, and that our federal government in particular and provincial governments have been supporting through their policies for quite some time now. So we're in a little bit of an era of, let's say, renewal of affordable housing right now with a new national housing strategy that just came out last year. And we're expecting at the provincial and municipal levels that that's going to have an impact on the types of housing that municipalities, nonprofit agencies within cities and within provinces, and of course those provincial housing authorities are going to be able to provide. So what I wanted to touch on a little bit today is my current research, which is around rental housing policy, really because I think it relates to exactly what we're talking about here, which is the need for a range of housing choices, and what cities are doing about that. And then I know Kasia is going to talk a little bit more specifically about what Halifax or what HRM is doing and can be doing. So this current project that I'm working on is comparison of rental housing policies across 15 Canadian cities. And I looked at 5 small to mid-sized cities, so with a population size of 200 to 400,000, and then mid-sized cities, which are between 400,000 and a million population, and then 5 large cities. And so what was interesting looking at so what I did is look at the official housing, if there's a housing strategy in that city, also the official plan, and whether they have any kind of local, bylaws or specific policies around to kind of, encourage the development of specific types of housing. So housing is really, a tripartite, it's a really, all 3 levels of government are involved in terms of everything from the, from funding and programs to at the municipal level, designating specific land uses and allowing certain types of housing in certain types of in zones within the city. And so some of the interesting things that I found were there were, rental housing is quite significant in our cities, particularly in our larger cities. So if you look at the population, the percentage of the population that's actually renting, it ranges from, within this sample anyway, from 25 to 66% of the households. So in the larger cities, 66% is Montreal, but we see that in, that sort of similar levels in Toronto and Calgary and Edmonton and these kind of larger cities. So we think of, our policy has really conceived of rental housing as being, let's say, less important than ownership housing, but it really is quite significant. It's really a huge proportion of the population that rents or does not own. And for the purposes of this study, I mean, rental housing could be anything from supportive housing that is provided maybe by a nonprofit or a government agency all the way up to market rental housing. So some of the interesting things that I found were there were some programs that, you know, every city had. So there were a couple that were that was possible because there was funding through CMHC or the provincial government. So things like rent supplements for low-income households, or renovations to existing affordable housing so that it enables that housing to remain affordable. Those are programs that, you know, every city had because they come through those higher levels of government. Most cities actually have condominium conversion policies that prevent rental housing from being converted into condos if the vacancy rate is below a certain percentage. Most of them do sell municipal land to develop affordable housing, and they can usually sell it at below market rates to nonprofit housing providers. And then there's another range of policies that sort of some cities have, but not all of them. So some of them do a good job at encouraging secondary suites. That could be a viable option for a lot of seniors. Reducing or eliminating development fees for affordable housing projects. So some cities do that to try to encourage the developers, like it's quite financially difficult to build affordable housing, so that's a little bit of an incentive for them. There are some cities, not very many, that actually offer capital grants to build new rental units, and these are typically cities that have had really major shortages in their rental housing supply. I'll talk about one of those later. And then there's about a third of them that have inclusionary zoning, which is a policy that would allow the city to require that a certain percentage of new units are affordable. And most of the cities that have inclusionary zoning have it in very specific areas of the city, maybe in the downtown, in the main street, specific nodes within the city. So it's not widespread. The only place where it is widespread is out of my cities that I looked at is in Winnipeg. And then there's another kind of range of policies that very few cities have, but that are really kind of innovative, and I thought it was worth bringing up here. So there are a few cities that actually have municipal development corporations. They're usually arm's length organizations, but they basically involve the city buying and developing land for affordable housing, and sometimes even managing those units. There are housing reserve funds that some cities have. They're quite popular on the West Coast. I think out of my sample, Victoria and Vancouver had those, but even some smaller cities like Kelowna actually have that. And usually that developers would put a proportion of the fees that they're paying towards the city into this housing reserve fund, and then that can be used to develop affordable housing. And then some cities, including Halifax, actually have property tax forgiveness for nonprofit housing. So if you're a nonprofit agency, or authority, you can apply for that. So that takes the kind of expenses down a little bit. And then Victoria and Saskatoon, out of the sample I looked at, have a large supply of like these municipal land banks. So they've been banking land for a long time, for 40, 50 years, and they can then use that land. They can either give or sell it to nonprofit developers to develop affordable housing. So there's this kind of range of programs that are a little more innovative that fewer cities have. And typically the cities that have, one of the ways that we chose the case studies for this project were we really wanted to get at some of those, pull out some of those really innovative policies. And some of them are quite small cities, like the province of Quebec is quite innovative. One of the programs I wanted to mention as a very unique program today is this program called Accès Logis that the province runs, and it supports the crowdsourcing of housing. So it basically allows community groups, nonprofits, and public agencies to apply for funding, and then the municipality also contributes a percentage of that funding towards the development of affordable housing. And it's basically, there's two types. There's creating permanent housing for low to middle income people, but there's also creating permanent housing for with supports for seniors. So there's two kind of groups of housing or types of housing that can be built through that. And Sherbrooke, which was the smallest sample or city in my sample, contributes 15% to these projects. And so just a very small city, just over 200,000 in population, they'll be able to build about 240 new units within the next couple of years through that program. So some of the cities actually have access through their provincial governments to some really unique sources of money. Saskatchewan has been really innovative on the development of rental housing as well. They have a specific program that allows, they offer forgivable loans for up to 70% of the construction costs if it's going to be low-income housing that's produced. So they have this rental development program, and it's accessible by not only by nonprofits but also for-profit firms, cooperatives, First Nations, and municipalities as well. So there's some really interesting programs out there that I think are really going to contribute or starting to contribute to more affordable rental housing supply. And then places like Edmonton are trying to really develop more supportive housing as well within their communities. And there's some really interesting community-based organizations that are helping with the development of housing in Edmonton. There's the Homeward Trust and Federation of Community Leagues are these two sort of nonprofit organizations that are really involved. They even actually create their own housing plans. So it's an interesting kind of approach where it's not just the city that's kind of creating these strategic plans and sort of initiatives for the development of supportive housing. So I think that that these types of, the goal behind this project was to look at, we are operating, most municipalities are operating under constraints, major economic constraints, that we have been in this kind of uncertainty, policy uncertainty and funding uncertainty for quite a long time. But what I really wanted to understand was, are there municipalities out there that have, despite that condition, still been able to implement innovative programs, innovative policies, and that's really what I found, is that there are some of them out there, regardless of the size of the city, its location, or other constraints on it, they have managed to do that. So that was really what I wanted to speak about today, and hopefully that some of that continues, and and that I want to share these kind of innovative approaches so that cities like Halifax can be a benefit from that. Thank you.
Our final speaker is Kasia Tota. Kasia is a principal planner with the Halifax Regional Municipality Planning and Development. Over the past 15 years, she's been part of a wide variety of projects and policy initiatives related to regional and community planning, community development, community partnerships, and extensive research on housing, homelessness, and neighborhood change. Kasia is currently part of the team of staff dedicated to the Centre Plan project and larger municipal plan and land use bylaw simplification. Great. Kasia has a master's degree in urban and rural planning from Dalhousie University, and an environmental science degree from McMaster University. So please join me in welcoming Kasia.
I'm the one with the slides, but thank you very much for the invitation. I feel very honored and privileged to be here to be part of this important conversation on truly an issue that touches each and every one of us, if not directly yet, then through our friends and family who are touched by the issue of housing for aging populations. I'm here to follow up on the challenge, Ren's challenge to innovation, what the local governments can do, and hope that I can inspire some of you, new and budding policymakers to get excited about policy at the local government level. It is truly important. It is a place that truly connects national issues to local issues, and it's where I think some true innovations can take place. So really excited to be here. So first of all, local governments. What do cities, towns, and villages do, and why do they exist? Well, obviously, this is where people live and choose to build their homes and their communities. And as Ren said, the diversity of policy approaches across the country is truly indicative of the local conditions, the provincial legislation that forms those communities, and I think as cities and towns are constantly pushing against those powers and limits of legislation and trying to respond to the needs of local communities. And certainly Halifax has been part of larger conversations at the provincial level and the federal level around the national housing strategy, and trying to really put forward the needs of our communities. So many of the local acts talk about the purpose, the fundamental purpose of cities and towns are to build healthy, safe, vibrant, economically prosperous communities. And we do have an extensive toolbox of policy tools that we can do. There are limits that we are trying to also remove, but fundamentally, regardless whether as a city, whether we have a direct role in the delivery of housing or not, cities through our planning policies and regulations have a tremendous role in shaping the housing markets and have the ability to provide or perhaps hold some of the social innovations around housing and the needs of our communities. Don't know how many people are here from are new to Halifax. Anyone? Yeah. Okay. A few. Okay. So in case you haven't really had a time to tour around, the Halifax Regional Municipality, we are a regional municipality. We were formed in 1996 from the city of Halifax, city of Dartmouth, town of Bedford, and the large county area. And we are actually the size of PEI. It takes about 2.5 hours to drive from one end of the municipality to the other. We are very urban and also very, very rural as well. So we have a whole slew of issues. So we are a bit of macrocosm of provincial issues when it comes to housing, any type of housing, but in particular housing for aging populations. We are growing probably a little quicker than some of the other communities in Nova Scotia, and also our aging population is also increasing. While we grew about 3% and between last two census periods, our aging population increased almost by 24%. So you can see that we are definitely as a whole aging, and there is a huge diversity among the aging populations, as was already mentioned. So aging population is a microcosm of a larger community and cannot be painted with one brush. So seniors housing is incredibly complex, and so is housing in general. We talk about housing in terms of housing continuum, which from everything from emergency shelters for the homeless aging populations, and here we also see huge aging trends through transition, supportive housing, assisted living, social housing, where affordability is obviously an issue. Rental housing, and we have extensive, I think close to 45% of our households are renter households, and ownership housing. So within that, there is a huge complexity and great opportunities to blend those models and to provide great diversity of housing. We also know that the majority of our aging populations actually lives in mainstream housing, so be it rental or ownership. This is a huge area where seniors live, and only really 3 to 4% live in assisted living or long-term care. So there's really opportunity for the private sector, nonprofit sector to address this, to address issues of aging. And unfortunately, as we all know from personal experiences, perhaps moving between the different forms of housing sometimes is not a choice. It often comes with a very acute health issue or others, and there's really very little time to plan, and it's really becomes an issue of crises. And when you are faced, or your loved ones are faced with this kind of situation, you really realize how perhaps limited some of the options are in your own community. So a few years ago, probably close to 10 years ago, there was a really extensive and really in-depth project looking at, out of Mount St. Vincent University, looking at the preferences and needs of seniors in Atlantic Canada, and it put out some key messages. I only picked a few, those that perhaps are most immediate to planning. And as we all know, seniors want to age at home, and not only in their own home, but in their own communities, and that's definitely a planning issue. Seniors are not thinking about the housing alternatives, as it's usually an emergency or very acute situation when you're forced with a choice to leave your own home and look at our options. And while the majority of seniors still prefer seniors-only housing, some do not. Some actually, and perhaps it's because of that's all we know, that's all that exists up to now. Many are actually would prefer to live in part of intergenerational communities and be part of kind of broader community with young people and kids around. And there is actually some interesting innovations in this area as well. So I'm not going to get into all of the different, I think Ren gave us quite a comprehensive list of things the local governments can do depending on their, community interests, political interests, their resources, their legislation. But I think there are some kind of main kind of planning themes that we as at HRM as well are trying to implement to move forward. So obviously, more housing options located in locations that are close to other services are sort of a key theme, a key opportunity. I just had this little story. Hopefully, let me know if I'm too long. But I recently had this wonderful opportunity of my aunt visiting from Poland. I haven't seen her in over 20 years, and she's a senior now. It's been a while, and it was just interesting to watch her and my mom compare notes about like their retirement years. Here in Halifax versus Bydgoszcz, Poland. Don't try to say that city name; it's very hard to pronounce. And, it was just amazing. She's like, I'm so busy. I do so much. I can help on the streetcar and go, there's free university classes being offered, local university, and there's exercise classes, and I can go and watch the symphony, for like 2 złotych, which is like $1, super cheap, free transit, and she was just bragging about, her whole experience, right, of how amazing his mom. So I was just like, Mom, don't pack your suitcases yet, But it just really was a great example of how, like how community can be organized around, aging populations. There's new events, new festivals, and really access to all those things that really help keep her really, really, really busy and engaged. So that's what we're trying to move towards in planning. Some more housing options, so things like secondary suites and backyard suites, coach houses, if you know what those are, tiny homes on lots. Shared housing, many of our land use planning policies are really pretty restrictive around those. Typically, we see them as group homes or rooming houses, but there are many other formats where, common areas are being shared with sort of smaller apartment units or just rooms. Ren already mentioned we do have low-income, tax exemptions for nonprofits, but also low-income seniors, which are really beneficial for rural seniors living in rural communities and trying to stay in their own homes. Those are really helpful. Home repairs here in Nova Scotia, that's more of the realm of the province. As well as energy retrofits, but in our Solar City program, for example, which offers financing help to install solar panels, can also go a long way towards energy security. Various incentives such as land density bonusing. We don't have our council actually has asked for inclusionary zoning under our charter. That's still being considered, but we do have a tool called density bonusing, and we are working hard to try to implement it under the central plan and other. And we just recently got the permission to use it throughout the municipality, not just in the urban core. The city has also implemented low-income transit pass. I think that's also really helpful to seniors who may not may not be able to drive anymore. So providing access to services such as shopping and other things. And I can underestimate the importance of streamlining approval processes. So as a city, we get to approve, say yes or no to pretty much anything that's built in the city. And under too many areas, this is a discretionary process. It's very lengthy and expensive. And it's very hard to get a call from a nonprofit who got this big fund from the province or government to build new housing. It's like, oh, you can't build it here or you can't build it there. And it's going to be a year before we, can allow you to build it. So that's a real challenge, and it's a symptom of very outdated land use regulations. So very quickly, this is a challenge for policymakers such as you. In our municipality right now, we have 21 municipal planning strategies, which translates into 481 zones. And this is the project that I'm working on. So if you come to our desk, what can build where? The answer is very, very difficult, very, very challenging. So the kind of long and public process updating those regulations is really critically important. This is our little secret shelf of binders. Sometimes less is more when you write policy. Just sort of keep in mind in your future careers. And I think it just goes back to, it's not just a matter of deleting some regulations or tweaking them. It really, when we try to look, our council actually recently asked us to look at the whole issue of seniors housing. And we realized we can't just tweak it. We need to really reopen those policy discussions. We need to update our policies, which were written in the 1970s, 80s, where we had the young population, where we had, car was the king, and everything was, was always separating various land uses. We really need to update everything. We can't just tweak it. So we can truly have complete communities where people can, live, workshop, learn, close to one another, and have many mobility choices. I know. So some of the key policy concepts that we are trying to bring to life as part of projects such as Center Plan are really about, strategic growth in the right places, close to services, pedestrians first, complete communities, and human scale design. So when you walk down the street, you feel like you're welcome and you don't feel, smothered by cars and tall buildings. So what can local governments do? Definitely the whole reform around land use policy is really critically important, because that really can stifle right now what's allowed, and doesn't really, in some cases, doesn't translate into the current values and needs of the community. We want to enable work with the private and nonprofit sector to develop new solutions, engage with local communities while the ideas are germinating, work in partnership with local governments, and obviously continue to work across the country, because some of the issues and struggles that we have here locally are very similar to what other cities and towns are experiencing in other places. And here's a plug for Center Plan. Stay engaged. It's coming. Thank you.
We're out of time. I'd just like to thank our panelists and our students for their great questions, and thank you all for being here. And I'm going to just ask for a speedy round of applause, and then I'm going to turn the microphone over to Kevin.